Are headaches and nausea a sign of pregnancy? Did you know that the first signs of pregnancy are nausea and headache? Around 70% of all moms-to-be would experience nausea and headaches, and they may occur during any time of the day. Nausea and headaches that are caused due to pregnancy is also referred to as morning sickness. These are the most prevalent and common symptoms of pregnancy. However, it is not only confined to the morning time. Nausea and headaches may be constant for some women, while for some, morning sickness may be an occasional event. The degree to which you are feeling nauseous or are feeling lightheaded may also differ. You may just feel drained out, or you may experience a full-fledged bout of vomiting. Nausea accompanied with headaches are among the premier signs of pregnancy. Usually, women mark the difference through their breasts becoming extremely tender, which is soon followed by nausea and headache. Thus, when we take the physiological signs of pregnancy into account, we may conclude breast tenderness to be the first noticeable sign. It has been marked that the onset of nausea is not conceived until between the 4th and 6th week of pregnancy. However, nausea and headache during pregnancy subside between the 12th and 14th week of pregnancy. Causes. There are predominantly two theories that express why women experience constant headache and nausea, followed by vomiting, during pregnancy. Progesterone, which is the dominant hormone during pregnancy, causes morning sickness. During pregnancy, progesterone is secreted by the ovaries. The amount that is secreted makes all the difference. The ovaries secrete progesterone in excess. This hormone soothes the muscular system, thereby preventing preterm labor. This is possible as it affects the uterine muscles. It also affects other muscles, such as the stomach and intestines, making the stomach sensitive and upset with discomfort. Progesterone, when secreted in excess, slows down the working of the digestive system. Thus, the elimination of bodily waste becomes slower, giving rise to erratic bowel movements and production of excess gastric acid. Apart from the above theory, there is another significant contribution of thought and research that is widely accepted. This theory focuses on the principle that morning sickness is caused by human chorionic gonadotropin hormone, HCG. It is during pregnancy that the level of HCG increases, and gradually diminishes from the 5th to the 15th week of pregnancy. How does this factor create nausea and headaches? Well, the high level of HCG in the bloodstream triggers a center in the brain that is responsible for eliciting a woozy feeling, leading to headache and nausea, closely followed by vomiting. Prevention. Try to avoid foods that aggravate the problem of nausea. It has been observed that greasy foods elicit a feeling of heaviness, and thus need to be avoided. In the morning, eat crackers regularly in order to increase the blood sugar level as well as prevent morning sickness. Consult your healthcare professional about your symptoms. If he asks you to add vitamin supplements to your diet plan, do so. However, do not consume any drugs without garnering an expert consult. Nibble on small and frequent snacks to palliate symptoms of morning sickness. Instead of 3 meals, switch to baby platters, that is, small meals, to be consumed at an interval of 2 hours. This keeps you satiated without exerting strain on your digestive system. Starving your system for long hours is never a good proposition, especially during gravidity. Take to fruits instead of chocolates, and make them your haven foods. Folic acid deficiency may also be a contributive agent in elevating nausea and subsequent headache. An approximate 1 mg of folic acid must be consumed every day. Ginger is a great remedy in order to curb nausea or headaches. Ginger biscuits or ginger tea could be appetizing alternatives. You could indulge in gently massaging your scalp and neck. This helps in relieving the tension. You can also massage your scalp with warm oil. However, you must keep in mind not to use oils that have strong fragrances. This may make you feel lightheaded and induce vomiting. Consume plenty of fluids, particularly water, in order to avoid dehydration. It could be a tough task for all those who are not habituated to consuming enough fluids regularly. However, for your well-being, drinking water could be of great help. Bask on plenty of sleep and rest. Rest could help you feel refreshed. It may be hard for those who are engaged in looking after their older kids. However, it would be beneficial if you take adequate amount of rest during the day and have a peaceful sleep at night. Headaches and nausea would be forgotten as soon as you behold the sight of your little one. However, until the 15-week tenure ends, you have to bear the discomfort.